Bismillahirrahmanirrahim. In the name of Allah, who is the most merciful and beneficial God. Assalamu alaikum everyone. My name is Aisha Tariq and my ID is 220132310004 and my department is BS Biotechnology batch 13. Today I am going to represent the topic electroconvulsive therapy, which is also known as ECT. Let's start with the topic I'm going to represent. Its history, introduction, purpose, electrophysiology, mechanism of actions, methods and techniques, how does electroconvulsive therapy work, effect of ECT, and types of seizure, types of ECT, preparation of electroconvulsive therapy, during electroconvulsive therapy, ethical issues, public opinion, patient experience, and we also talk about the recent research. So let's start with the history. It is one of the oldest method in field of psychiatry. Hugo Saletti and Lucio Bini used an electric current to elicit an epileptic seizure for therapeutic purpose. In 1940, electroconvulsive therapy was introduced in the US with use of courier as a muscle relaxant. In 1970, most common electrode positions for right unilateral electroconvulsive therapy is developed. An Italian scientist, Ugo Saletti and Lucio Bini subsequently succeeded in applying electricity directly to the human scalp through the wires. In 1938, they treated an unidentified 39-year-old man who was found delusion in a train station. He recovered fully after 11 treatment without any adverse effect. So let's move forward. What is our topic? So it is electroconvulsive therapy. So what is electroconvulsive therapy? Electroconvulsive therapy is also known as electric shock therapy. Is a standard psychiatric treatment in which electricity is delivered through the scalp to induce a controlled tonic clinic seizure, usually at regular intervals to achieve an improvement in an abnormal mental state. Let's move to the next point, which is it is estimated that about 1 million patients worldwide and 1 lakh in the United States received ECT annually. Its safety and efficiency has been much improved with modification of various aspects of the techniques, such as optimization of the stimulus energy, electrode placement, the use and optimization of general anesthesia, as well improvement in cardiopulmonary management. So, what is the exact definition of ECT? So, artificial induction of a grand mal seizure through the application of electric current to the brain. The stimulus is applied through electrodes which are placed either bilaterally in the frontotemporal region or unilaterally on the non-dominant side. These are the two types. So what is parameters? The voltage we use in ECT is 70 to 120 volts and its duration is 7 to 1.5 seconds. In this diagram, they can explain that how electroconvulsive therapy is work on human scalp. So let's move forward that what is the purpose of electroconvulsive therapy. So there are three basic purpose. When the drugs are not available for quick recovery of patients, when the patient needs to get back to work quickly and they want these to work fast on them. That's why we use electroconvulsive therapy. Let's move forwards. Electrophysiology. Neurons maintain a resting membrane potential across plasma membrane. Normal brain activity is desynchronized neuron fire action potentials asynchronously A convulsion or seizure occur when a large percentage of neurons fire in unison. The rhythmical change in extracellular potential maintains the neighboring neurons and propagates the seizure activity across the cortex into deeper structure. Eventually, the entire brain shows high voltage synchronous neuronal firing. Let's move forward to the mechanism of action. Human and animal studies show that ECT increases release of monoamine neurotransmitters, particularly dopamine, serotonin, and norepinephrine. ECT also enhances monoamine transmission by desensitizing presynaptic adrenergic autoreceptors. The neuroendocrine hypothesis suggests that ECT relieves depression by causing the hypothalamus or pituitary gland to release hormones, including prolactin, thyroid stimulating hormones, adrenocorticotropic hormone, and endorphins. ECT has anticonvulsant properties, perhaps related to neurohormones, and enhance gamma aminobutyric acid transmission, which has led to the suggestion that these properties are responsible for the therapeutic effect of the treatment. Let's move to the forward to techniques or methods we used in ECT. ECT can be given by a direct and indirect method. The patient is administered atropine sulfate subconsciously 0.6 mg to 1 mg half an hour before the treatment or 4 immediately before the treatment. Minor tranquilizer like calm pause is used. Let's move to the forward that how does ECT work. So there are different methods like neurotransmitter theory, neuroendocrine theory, anticonvulsant theory, brain damage theory, and psychological theory. So let's start with the ECT and neurotransmitter. So it has been seen that there are subtle changes in the neurotransmitter receptors and second messenger system. Virtually all the neurotransmitters are affected. A series of ECT sessions show a down regulation of postsynaptic B adrenergic receptors. Reported changes in dopamine, muscarinic, and cholinergic receptors have been found. However, effects of electroconvulsive therapy on serotonergic neuron remain controversial. In second messenger system, ECT has been recorded to affect G protein in coupling to receptors, activity of adenyl cyclase and phospholipase C, regulation of calcium entry in neurons. So let's move to the another slide, which is neuroendocrine theory. So what is neuroendocrine theory? The seizure causes the hypothalamus to release chemicals that cause changes throughout the body. There are many chemicals which are released from the hypothalamus. The seizure may release a neuropeptide that regulate mood and it proves beneficial. So brain damage theory. Shock damages the brain, causing memory loss and disorientation that create an illusion that problems are gone, and euphoria, which is frequently observed result of brain injury. Next is psychological theory. Depressed people often feel guilty, and ECT satisfies their need for punishment. The dramatic nature of ECT, we known as dramatic nature ECT because of its electric shock, and the nursing care afterwards make patient feel they are being taken seriously. The placebo effect, psychological theories of depression focus on learned helplessness and the depressive cognitive schemes as well as or psychosocial treatment. A more dramatic physical treatment, electroconvulsive therapy, is sometimes used. Anticonvulsant theory. Electroconvulsive therapy itself acts as anticonvulsant theory because its administration is associated with an increase in seizure threshold as treatment process. Recent data show that 1 to 2 months following an electroconvulsive therapy session, EEG records a large increase in the slow wave delta activity in prefrontal cortex. Decreased slow wave sleep has been found to be associated with increased negative symptoms. ECT have been found to regulate cellular mechanism of memory and mood regulation. So let's move to the forward effects of ECT. Basically, the side effect of ECT. So there are two types of effects, like short-term effects and long-term effects. So firstly, we discuss about the short-term effects. So nausea, headache, fatigue, confusion, slightly memory loss. These are the short-term effects of electroconvulsive therapy. It may last from a minute to some hours. So, what is the long term effect? So, there are many long term effects like apathy, loss of interest in things, loss of creativity, drive, and energy, difficulty on concentrating on something. These are all the long term side effects of ECT. Types of seizure produced. So there are two types of seizure which are produced: grand mal seizures, clonic seizure. So grand mal seizure, tonic phase is lasting from 10 to 15 seconds, and in clonic phase lasting for 30 to 60 seconds. Let's move forward. So we talk about the types according to technique, direct ECT and modified ECT. But according to the placement of electrodes, there are two types: bilateral electroconvulsive therapy, unilateral electroconvulsive therapy. So we talk about the bilateral electroconvulsive therapy. So in this, two electrodes are placed on your temples, one on each side of your head, so the electric current passes across your whole brain. Bilateral ECT is when the current is passed through both sides of your head. Each electrode is placed 2.5 to 4 centimeter inch. Bilateral ECT is introduced first, then unilateral ECT. Electrodes are placed apart over each hemisphere. More rapid therapeutic response. The most common bilateral ECT is bitemporal. So in diagram, as you seen here, there are two electrodes which is placed on human brain so that the current is passed through it, and its size is 2 to 3 centimeter. Let's move forward to the next type of ECT, unilateral ECT. What is unilateral ECT? Unilateral ECT convulsive therapy is a technique to which a current is passed across the non-dominant cerebral hemisphere, producing a generalized convulsion. As a treatment modality, electrodes are placed over the non-dominant right hemisphere. Another electrode usually placed on the non-dominant centroparietal scalp, just lateral to midline vertex. That makes the difference between unilateral and bilateral ECT. That these are placed on the non-dominant parts. So here in the diagram, as we can see, that these are placed on the non-dominant parts, and its size is also 2 to 3 centimeter electrode size. So what is the process or preparation we need to start our process of ECT or preparation for ECT? So first of all, consent of the patient and relatives. It's very important to tell them that what is ECT to the patient and also their parents or their children's, basically their relatives. It's an important step to know them that what this process is or what is the side effect of this process. Pre-medications, we need the medication, we need to start the medication of the patients. Check previous finding of ECT, that the person in before know about ECT. Routine investigation and physical examination. Result for re-ECT. Explain procedure to the patient, its level of understanding. That the patient come to know that what is ECT. After that process, he don't come to you for complaining or anything. Other psychosocial evolution of memory, communication the positive feeling of ECT, ensure the patient is NPO at least 6 hours before. The procedure discourage cigarette smoking just before the procedure to avoid increased efficiency on managing pulmonary secretions. Remove denature like eyeglasses, jewelry, contact lenses, loosen the cloths because tightened cloths are also not good. Empty bowl or end bladder, monitor vital signs, make sure that ET tube and a cylinder is accessible and function in case of emergency. Show a warm supported altitude to recipient. Transfer the patient to ECT with all necessary search. And what is the most important step, that you need to record all the investigation you done. Let's move forward, that what you need to do during the electroconvulsive therapy. So reassure the patient until the anesthetic effect take place. Position the patient in a spine position. Administer necessary drugs. Mouth gaps placed. O2 is given before and after administration of sideline. O2 means oxygen here. Electric current is applied because we basic purpose of ECT is applied electric current through the scalp to active brain or something like that. So electric current is applied. One attendant laced or a nurse hands on both eyes near knees point, and another attendant hold the shoulder to prevent fall because it is kind of electric shock. That's why it's our safety precaution to save the patient. And fracture and dissolution. After seizure occur, mouth gap is removed and the secretion suck up oxygen given. Ethical issue. The Union Health Ministry of India has decided in the Mental Health Care Bill of 2010 that they will scale direct ECT. The Health Ministry recommended a ban on the whole procedure. The World Health Organization, in its 2005 publication, Human Rights and Legislation, who resource book on mental health, specifically states ECT should be administered only after obtaining informed consent. Let's move forward to the next slide, which is about public opinion. That what is the public opinion about electroconvulsive therapy, which is also known as ECT. So the APA ECT task force guidelines report finding that public opinion varies greatly about ECT use, but mostly the general opinion is on the negative side, which is not good. So let's talk about the patient experience, that what type of patients experience patients have. Nice ECT guidelines report that some individual consider ECT to have been a beneficial and life-saving treatment, while other reported feelings of terror, shame, and distress, which is not good but it is on the negative sides, and found it positively harmful and an abusive invasion of personal autonomy, especially when administered without their consent. So there are basically both type of people, some who like electroconvulsive therapy on positive side and some which feel terror feelings or something like that, so they feel shame, distress, so they are on the negative side. Let's move forward to the next slide, which is about recent research about ECT, that what people think about ECT now. So extensive research has found ECT to be highly effective for the relief of major depression. People who suffer from depression and medication is not one way for them, so they prefer electric convulsive therapy, and many patients supports that they feel relief to stress. Clinical evidence indicates that for individuals with uncomplicated but severe major depression, ECT will produce substantial improvement in approximately 80% of patients. So these are the recent research about electroconvulsive therapy, and some people feel that it is beneficial side, but also something like that negative comments about that because they feel shame or something like that. Let's move forward. There's some reference which I give, and I prefer I choose slides from there, and also some YouTube videos which help me and provide information. Thank you. That's all from my side. I hope you will get it.